Recording process.
Hey everyone, it looks like the participants are starting to file in, so we'll give it a moment before we start the webinar. I want to thank everyone for joining tonight. Give it a few moments, let everyone file in. Awesome. So I guess we can go ahead and get started. As I just mentioned, I want to thank everyone for joining our virtual learning series tonight. We have a great group of panel doctors here to share their story with you. This month's topic is road less travel, which highlights our docs journey starting from the beginning of dental school or even before their dental school journey, what motivated them to get where they are today. Just to introduce myself, my name is Miles Murphy, one of the senior managers here on the academic team with Aspen Dental. And my job is to connect with all of you here through a variety of events to educate you on what Aspen Dental can offer you as in a career choice. So I'm going to let my doctors introduce themselves as well. So Dr. Babore, if you want to go ahead and start, followed by Dr. Flores.
Sure. Hi, everyone. My name's Simone, or Dr. Babore. I started with Aspen a year and a half ago. I graduated from the University of Colorado from small Crown Point, Indiana, right outside Chicago. I went to school in Michigan and then moved to Denver, and I lived there for about 9 years. Dental school and some other things there as well before I ended up moving to St. Louis to work for Aspen a year and a half ago, and I've been loving it ever since.
Awesome. Thank you, Dr. Babore. Dr. Flores, if you want to go ahead and introduce yourself.
Hello, everyone. I'm Dr. Larissa Flores. It's a pleasure to be here tonight. I am a graduate from Temple Dental School in Philadelphia, class of 2019, and I own and operate the office in El Paso, Texas. It's a pleasure to be here tonight, and I look forward to answering some of your questions about Aspen.
Awesome. Thank you, docs. So before I get into the questions, I just want to inform all the attendees tonight that there is a question box on the bottom of your screen. So you're able to ask the doctors live questions, anything that comes top of mind, please feel free. This is, the floor is yours. We really want to educate you here and ask any questions that you guys have to learn a little bit more about Aspen Dental. So I know that our doctors introduced themselves. So to go a little bit more in depth, if you want to just walk us through your dentistry story. So Dr. Babore, if you can kind of give us an overview of your path to dentistry. I know that you have a story about your pre-dental past, and then what led you to dentistry to get you where you are today. So if you just want to touch upon that, that'll be great.
Sure. So I went to school in Grand Valley State University for my undergrad, and I got my degree in biomedical science. I knew that during sophomore and junior year, I wanted to do something in the medical field, but I wasn't sure what I wanted to do yet. So really, I knew I wanted to be my own boss. I wanted to work my own schedule, and to help people was the biggest thing. And so for me, that kind of narrowed it down to being a physician or being a dentist. When I went through my junior year in college, I realized I'm like, okay, I'm not ready to do another 4 years of school again. And so I applied for Teach for America and for the Peace Corps. After getting admitted into both of the programs, I was trying to weigh my options, and I decided to go with Teach for America. And so I moved, not having ever taught before, to Denver to teach in an underprivileged part of the city, where most of my kids didn't have English as their first language, were behind reading level, math level, that kind of thing. So for me, I was like, I want to take my break from dental school and try to give back, kind of help people, still making some of an income, and then trying to figure out, do I apply to dental school or med school? So I taught ninth grade physics for 3 years, which was very interesting and funny now because I feel like we do a lot of that in dentistry. I applied during my 3rd year of teaching to dental school, but since I had graduated 3 years prior, my GPA wasn't high enough to get admittance, so I didn't get it my first year. Applied again my second year, and I did a 9-month master's program at the University of Northern Colorado, and was admitted to all kinds of schools all over. So I decided to stay in Colorado. I loved it, and I stayed there for my years of dental school, and then ended up moving over to St. Louis to work with Aspen. So I've been, part of teaching, or part of the side of having to teach in underprivileged communities. And for me, it was I wanted to give back to other people as well. And so that was a big part of the reason that I chose to work in the area that I'm working now, and for this company as well. So yeah.
Awesome. Thank you, Dr. Favore. Dr. Flores, if you want to go ahead and take the floor here.
Awesome. Very cool, Dr. Favore. That's an awesome story. I love it. So I had a bit of a different path towards dentistry. When I was 5 years old, I told my mom I wanted to be a dentist. I had an accident that led me to it, which typically most kids would shy away from dentistry if they've had a traumatic experience, but thankfully it's what brought me to my beautiful career. I was running around my house and I tripped and fell and I hit my 2 front teeth, and they were still my baby teeth, thankfully. So my mom took me to our family friend that was right next door to my grandparents' house in Mexico. She's an orthodontist in Mexico, and she saw that my 2 little teeth were getting ready to exfoliate anyways. So went ahead and we extracted them. Thankfully, it was a very non-traumatic experience, and it's the main reason why I decided I wanted to be a dentist. Everyone thought that eventually I would change my mind, and thankfully it's been the best decision that I've ever made, as crazy as it sounds. I stuck with it all through high school. College, I did my biomedical science degree at UTEP, the University of Texas at El Paso, which is where I'm born and raised. And I thankfully applied to multiple dental schools, particularly the dental schools here in Texas. And my husband, now who was my fiance then, was doing podiatry, foot and ankle up in Philadelphia at Temple. So I applied to the East Coast schools too, thinking if I don't get a Texas school, I can be out on the East Coast or vice versa. So thankfully I got into Temple, which is an excellent school. I don't know if anyone out there is a Temple owl, but it was a wonderful school. I loved Philadelphia. I was there for 4 years. A big change from El Paso, which is a desert city. I'd never seen snow up until I moved up there, and that was wonderful. I did my 4 years out there, loved every moment of it. Dental school is tough. I know you guys all know about that. It's tough anywhere you go, but if you find a place where you like to be, it makes it easier to live and go through school. In my first year of dental school, I started becoming involved with ASDA. And through ASDA, I became basically the education liaison and the vendor liaison. So I had all of the vendors that would come to the school come through me, and I would organize lunch and learns, and I would organize the vendor fairs. And that is how I got in contact with Aspen to begin with. I actually was able to see a little bit about all the DSOs. That gave me the opportunity to kind of really do my research early on, starting with my very first year, which is a big blessing. I was able to see and compare throughout the years. I remained in that role, and I got to see Pacific, Midwestern, Heartland, and a couple others that we know are out there. But Aspen always stood out as the best because it gave you the opportunity to own. And I knew, as Dr. Favor knew too, that I wanted to be my own boss. I wanted to be my own practice owner. So Aspen was the one company, one DSO that actually gave us that opportunity to buy into the practice and be the owner of your practice. So in my third year, I was invited to Vibe. You guys might have heard of Vibe. It's an event where you get to go and see what Aspen is all about. And I went to Atlanta, where I got to really see what it was all about and fell in love even more so with the company. And I had to get my husband on board because we were both ready to come back home. We're both from El Paso, Texas, and he was ready to come home after being away for over 7 years. So in my fourth year, I got invited to a second Vibe, and I invited him so he could go ahead and see what Aspen was all about. And thankfully, he fell in love with Aspen too. And he's like, let's do this. We got to make sure that we can get an Aspen into El Paso. So long story short, I'll give you more details about it. I spoke to Bob Fontana. He said, let's make it happen. Bob is our CEO, which is amazing. And here I am in 2021. I opened my office in El Paso. It's the first here in this area. And it's been exciting for the last 2 years, growing my business and opening up this beautiful market.
Awesome. Thank you, Dr. Flores. You have a super unique story. I'm always super happy to hear about it. To kind of like piggyback on what you said and your path to ownership, Dr. Favor, I know that you're going to become a partner soon. If you want to touch base on that and what your path looked like and why you decided to buy into the partnership model here with Aspen.
Good question. I think I'm a little different than Dr. Flores, as I wasn't sold on Aspen at first at all. I had never worked in the dental field, so I went into dental school not knowing what a class 2 was, not knowing anything. And I was like, great, I want to be my own boss. I want to help people. I want to help them with their smiles, get them out of pain. And I feel like this is a field I would like to go into. And so I knew a little bit about it, but not at all to the extent of like having a background on it. So everything that I had heard from about Aspen was, consistently kind of negative, as in, they rush patients through, there's so many patients, whatever, all these kind of different stigmas are. And so for me, during my sophomore, maybe my D2 or D3 year, during Christmas break, there was an Aspen in my hometown or the town next over. I called over and was like, hey, can I just shadow for like a day or two? I'm just really curious to see what it's about. I've heard a lot about it, but I've never known anybody that worked there or could talk, candidly about it. So I just want to just get a perspective on what they did. And I remember like the coolest thing, I had not taken out a tooth ever before. I think I had numbed a patient like once and like done an occlusal filling. And I watched this guy like do a full mouth extraction, put in dentures within like 45 minutes. And I was like, holy cow, what is this? And then would jump into the next room and see a crown, jump into the next room, do a couple of fillings. And it was like, for me, I'm super passionate about, I love diversity. I love that every day I have a structure to my routine. I know exactly kind of what my schedule is going to look like. I'm going to have extractions and fillings and crown preps and maybe some root canals and some implants and some Invisalign or clear aligners. And there's just a lot of variety. And I really loved that. And so after kind of seeing that, I was like, okay, cool. This is a company I think I could work for. I was also really drawn to it because of the amount of associates that they onboard every year. When I was interviewing for other practices and I was looking at private or doing a GPR or going into Aspen or whatever it was, the biggest thing for me is that Aspen has onboarded thousands of new grads each year, or not that, but hundreds of each year, more than 1,000 total. And when I was looking at the private practices, they may have never onboarded a new dentist. So they don't know what their mentorship style looks like. They don't know how to support new graduates that are going to need a little bit more help than maybe a more practiced dentist. And so that was a lot of the reason I decided to join Aspen in the first place. When I came in, I was an associate. The guy that had my managing director who was the second dentist or the lead in my office, ended up buying a practice and nearby. And so after a month and a half, he had transitioned over and I was fully running the clinic on my own, which was terrifying at first, but it was a big learning curve for me. I put in a lot of work into it and I was solo for about 10 months, got an associate this last year. And so I've been working closely with him and I'm training him into my role and transitioning to another one as well. So I found that Aspen has supported me in ways that I don't think I could have gotten out of another practice. My biggest thing I was looking for is I wanted mentorship, I wanted opportunity, but I've always thought about Aspen as using it as a tool to figure out how it can propel me further in my career and the things that I wanted. What I really want is diversity, being able to help people, reaching as many people as possible, and doing a job that I love and that is just really fun. And I get that with Aspen. And so that was the reason that I decided to kind of buy in, to partner with my current owner, and I'm partnering in another office in a couple of months here too.
Awesome. Thank you, Dr. Babore. So we're going to stay on the ownership piece for a little bit longer. We're getting some great questions. I want to thank everyone who's asking questions. So Dr. Flores, we have a question that came in. How many years of working with Aspen before you started the conversation of ownership? Were you an MCD? So pretty much like once you started with Aspen, how many years did it kind of take you to transition to an owner? And then also to kind of expand on that question a little bit, what kind of support does Aspen give you and help you with when you're establishing your practice?
So my path is very different from most people. I started my conversation about ownership when I was a junior in dental school at D3. I spoke to a couple of people and tried to see if I could make El Paso happen, because El Paso was not a market that Aspen was in before. So it took a while to go ahead and present my view to a couple of people. I had to present it to real estate, to marketing. I spoke to Bob about it, to Dr. Judge as well. And I was able to meet the right people little by little and kind of just put myself out there as the person who wanted to open up in El Paso and own El Paso. When I first presented it in my third year, they told me that El Paso was a very difficult market because it's a border town. It's a border town to Juarez, Mexico, which is literally right across. Like when I look through the freeway, I can see Mexico right across the border from me. And they thought it was a market that would be difficult to tap into because there's a lot of bilingual patients here and a lot of just Spanish speakers. But I was born and raised here, and my dream was to serve my community and come back home. So I pushed my my vision, and thankfully, in my fourth year, I was able to come across the right group of people who were able to do more digging into the El Paso market. Aspen does an excellent job at looking into areas that are underserved and need to have dentistry. And they looked into the metrics and were able to see that there was over 1 million people here. The need was absolutely there, and it's an underserved community. So they realized, like, this is a place that we could definitely work in. However, they were a little worried that no one would want to go and work there because they think El Paso, like, who talks about El Paso, right? In Texas, everyone talks Dallas, Houston, Austin, San Antonio. But I let them know, like, I want to go there. I was born and raised there. That's my dream. So if you can make it happen, I want to go back home. I will go back home and practice back home, whether it's with Aspen or not. But I would like to take Aspen there. That would be something that I would love to do. And thankfully, I was able to meet the right people and get my foot in the door that way. I worked in Midland, Texas. I did let them know I'll work somewhere else because obviously as a fresh grad, I knew I wanted to own, but I knew that it was nearly impossible for them to say, here's a brand new office and, let's see how you do as a fresh grad. So I told him I'll give you a year anywhere else around the area, which my closest Aspen all around is a 4-hour radius. So I have to drive 4 hours west or east or northeast in order to get to an Aspen, which is quite far. It's at least 300 miles around. So I'm in a little island here. Basically, I worked in Midland, Texas, and I was there for a year. And I asked him to put me in an office where I could see if I could do it on my own. And thankfully, I partnered with Dr. Shingala. He allowed me to work in his office in Midland, Texas, and I was working there, and I was an MCD right off the bat. I think I did like maybe 4 weeks in his office with him in Odessa, and then jumped right into working solo in Midland, Texas. And I was there for the entire year. The pandemic obviously happened in 2020 in March, and we had to take a 6-week hiatus for the pandemic, and that halted all of real estate. So El Paso was off the table for a moment there. And I thought for a second, like, is this gonna fall through? Is it gonna happen? Thankfully, I pushed my way through, and I was like, no, if this is gonna happen, I need to be certain that it's gonna open in this next year. Otherwise, I signed on for a year contract, and I'll be putting in my notice because May is when I'm done with my year. I have to go back home. I had been recently married, and we were living apart. My husband was here in El Paso, and I was in Midland. So it was quite a sacrifice, but I was willing to make it so that I could see my vision come to life. Thankfully, I was able to get my practice opened in 2021, and February 2021 is when we were able to open it. So for the time that I was out of Midland, I traveled all over Texas and worked in different offices where they had me training the team on culture and how to get patients to yes, and how to get the team on the same page. So I practiced in over 15 different offices all over Texas, and I helped train the teams there. So it was a great experience. I got to meet a lot of different dentists. I got to meet a lot of different team members, and it was kind of a blessing in disguise to not have the office open right away, because it gave me an opportunity to see what I wanted to do in my office and what I definitely did not want to do in my office. It gave me an opportunity to really hone in on some leadership skills, and it gave me an opportunity to kind of build character, greater character, and build a tougher skin, because you have to be able to roll with the punches and kind of be able to be flexible in any situation. But in healthcare specifically, you deal with so many different situations and so many different people. It gave me an opportunity to really experience that and learn how to deal with different personalities. So I know it's a long question and a long answer, but that's how Aspen really supported me in being able to see my vision come to life and opened up a practice here for me. It had to do with the fact that it's an underserved community. I was opening up a practice in an area that's an untapped market. And I really made an effort to show them that I wanted it and I was ready for it. And it had to do everything with being willing to be in a situation that was not quite comfortable and still show that I was willing to grow from it.
Awesome. Thank you, Dr. Flores. So I wanted to transition to Dr. Babore here regarding, I know that you mentioned being the only doctor in your practice. We got a question that came in. When you're the only doctor in your practice for 10 months, where would you go to mentorship? I know that we previously spoke about this, that one of the reasons, you touched upon it as well, was one of the reasons why you joined Aspen was you sought out mentorship, and that was super, super important to you right out of dental school. So when you are the only doctor in your practice, where would you go for mentorship?
Good question. So I'm lucky that my owner and now my business partner, his name's Dr. Alex. He owns currently 6 offices in the St. Louis market. So he's the biggest kind of mid-level owner in the Midwest or in this little region. And he has a network of, when I started, I think 12 or 13 dentists that were already working for him. So he does a really great job. So yes, I was in my office every single day by myself solo. He would be in the office 1 day a week. So you get a full day with him. So I would save a lot of my questions and like, how am I reading the CBCT? Am I like, what would your diagnosis be on this new patient? Like, what did you think about like doing this bridge, like a bridge versus like, whatever. And so kind of trying to figure out and kind of understand or trying to work through a few things. So I would do that weekly with him. He was always also available. He's great. He works in all his offices every single week, but he's really great about like, if I have something going on with the patient, I don't know what to do, I can immediately call him and he'll stop what he's doing. He'll call me, he'll immediately answer. We'll walk through it. I can send him over x-rays, pictures, whatever. Or if he's in the middle of a procedure, he'll immediately call me back within a few minutes. So really supportive in that way. He also does monthly dinners. So he does a monthly dinner with all of his doctors. Then the second month he'll do with only his MCDs. And then the third month he'll do with all his office managers. And so he invites all of his doctors, like you can come to any of the dinners. It's not like you're excluded from it, but there's specific things I need to talk to with each group. But if you're interested and want to know more about like running the office, like on the business side, you can come to the office manager stuff. Like what are the things we're looking at? From like just a solely running the business kind of perspective as just a general doctor and then a managing director, what are those kinds of differences? And so I had a lot of that kind of support. And it was also really lucky where most of the people in my office, like my office managers, my lab technicians had been there for a couple of years. And so I feel like when there was like, even just like questions about how do I, what would the coding be like if I'm going to do a bridge and I need to extract this tooth, like, should I prep it and then scan and then temp and then extract? Like, how do I, what's the best process to kind of do this to be efficient? So it's not necessarily just a doctor mentor I was looking for. I also want to know about the business side of it. I think it's important to know like how you're going to make money. What's the best way to kind of do this efficiently? How do you run a successful business where your staff's happy, you're happy, the patients are happy, where you can go home every day and be like, okay, great, that was a good job. You know what I mean? Like did a lot of kind of stuff today. But generally patients left like really happy with what we kind of were able to provide for them. And so that was the biggest thing for me. I needed some extra support because I knew I wasn't ready to be completely by myself yet.
Awesome. Thank you, Dr. Babore. So there's a lot of questions coming in. So I want to kind of combine 2 questions here. So I know that you guys both decided to go and work right away instead of choosing a GPR, right? So I want to kind of touch upon that a little bit. And I also want to combine it with another question that came in regarding, so we have someone that asked, they're hoping to gain new clinical skills in their career with Aspen. And they feel that dental school didn't prepare them. So to kind of combine that, as a D4, Dr. Babore, I want to kind of start with you because you graduated in 2021, which you were still kind of like in the middle of like COVID. And that would actually give you more of a reason to start to do a GPR, right? To get another year to hone your skills. So what made you decide on working right away, not choosing a GPR? And then Dr. Flores will have you answer the same question as well. But Dr. Babore, if you want to start it, I think this will be some great insight because this is on a top of mind for a lot of students.
Cool. Good question. So I actually was into a GPR before I even started looking and applying at jobs. So I was like, okay, COVID, like I'm probably going to need another year because I've taken out like 8 teeth. I've prepped a couple crowns. You know what I mean? I've done like 5 dentures, like start to finish. I was like, I don't know what the hell I'm doing. So I'm like, I need to get, my skills under control. So I applied to GPRs, AEGDs, got into a couple of them. As I was kind of deciding in like beginning of January, I was talking to a lot of the fellows and I went to University of Colorado and their residents there. And I was curious as to how their experience in their clinic would be maybe different than undergrad. I'm like, surely they're seeing more patients or more complicated cases and whatnot. And it was still the similar thing of like, you have one patient for 4 hours in the morning and then a patient for 4 hours in the afternoon. And that's even sometimes. And so I was very concerned that I would be either paying or be getting paid not very much to be going in and spending a year maybe seeing less patients than I really was kind of expecting. And so based on that and kind of hearing all the limitations and the red tape that a lot of the residents were currently in with the kind of COVID and the adjusting, I decided to pull my offers and I started applying very fast to jobs. And so a big part for me, I was like, I want the experience. I want to do as much as I can. And so I was lucky to, I forgot to mention this as well, that I got asked in my contract, I wanted more leadership and I wanted to learn more opportunities. I told the owner as I was signing on, I'm like, I'm treating this as a GPR. I want to be thinking like, okay, what are the things I'm going to learn? I want to be able to learn clear aligners. I want to learn implants. I want to be like a better leader. I want to motivate my team to work well for me because they want to be better, not just because it's a job that they come to every day. And so my owner actually wrote into my contract that I was going to go to a leadership conference and an implant course in that first year. And so that was a big tug for me, I think. He was like, okay, he's invested in me from the beginning. You know, this guy's met me for like a couple hours over like Zoom. And then like I flew out to St. Louis and that was it. And so I was like all on board with that. And so that was the biggest reason I feel like the experience, the diversity of everything, I'd practice all the skills that I wasn't able necessarily to always get in dental school. I was going to be able to do it, you know, in more of a work setting, but still under the guidance of having someone else there with me.
Awesome. Thank you, Dr. Babore. Dr. Flores, we'd love to hear from you on this topic as well.
So I had a different experience. I graduated in 2019 and Temple gets you pretty prepared, thankfully. I had also gone on a mission trip to the Dominican Republic and I'd pulled over 400 teeth. So I felt pretty comfortable. We did a ton of treatment and we lived in an area. Temple's located in Philly. If you guys don't know, it's in a very underserved area. So there's a lot of patients that come to you. It's right in North Philly. So basically all of your patients, they need your help. They have a ton of cavities, a ton of periodontal disease. They've got rampant decay that is not restorable. So you have a lot to learn from and you get to really practice a lot. When I was in dental school, I made it a point to make sure that I tackled the hardest things that I possibly could, because I figured this is when I have all of these brilliant minds backing me up. If I get into a situation where I am stuck, someone can come and unstick me, basically. So it was super duper helpful to know that I had a ton of professors that were just right down the hallway and I could give any one of them a shout and have them come over and bail me out if I needed to. So I made it my mission to go for harder treatment and tougher treatment plans and not shy away from cases. A lot of times I think what happens is you'll go into school and you'll try to play it safe because you want to make sure that you get everything perfectly right. But it's really, I always encourage students, like, make sure this is a time you make mistakes. And I'm not saying make foolish mistakes, but get yourself into treatment, into cases that are more difficult because you have so many resources available to you that are right down the hallway. So that's what I did. I made sure that if I had a case where I had to do a surgical extraction, I asked for permission to do the surgical extraction myself starting my junior year. And they really wouldn't let you do it unless you had extracted a certain amount of teeth. But I'd always be like, can I please try? Can I please try? Let me try before you try. And it gave me the opportunity to really get a lot of treatment under my belt as a student. I did the same thing with crowns and with dentures. I made sure that I went above and beyond the amount of requirements to pass and really to to ace the requirements. And our school worked in clusters. So as long as your entire cluster was doing well and the other students were getting their requirements completed, if there was anything that was extra, you were allowed to do it if you wanted to. So I would do that. When I was getting ready to graduate, I knew I didn't want to do a GPR or an AGD. And I figured I wasn't ready to decide and settle on a specialty. I thought I was going to do ortho, but then I realized I really loved extractions and I loved surgery and I loved restorative, and I couldn't decide what I wanted to do. So I decided general would be exactly what gives me the entire floor to choose what type of dentistry I want to do on a daily basis. So Aspen is really great at giving us the opportunity to really dip our toe in every pool that you are comfortable with. And I say that very honestly, like if you're not comfortable with endo, you do not have to do endo, which is wonderful. I can do endo from premolars forward is my choice. Anything back, I refer, because it's going to take too long and it's going to be tedious for the patient. No one wants to sit in a chair for over 3 hours when I know that my colleague down the road, who's an endodontist and board certified, can do it in an hour and pain-free for that patient. So I refer my molars out for that reason. But like I said, I love surgery. So I do all my extractions. Unless someone wants to be IV sedated, then I provide an oral surgeon who I work with, Dr. Frenzel. He comes once a month and he does those cases for me for patients who wish to be IV sedated. I did that one course that Dr. Favor was talking about. I did an implant course my second year with Aspen. I went to Guadalajara and it was the most incredible CE course that I've taken. It really let you dive in and learn the didactic portion of it prior to going to the course, and then getting there and really learning how to place the implants with live patients, with doctors that are periodontists, oral surgeons, and prosthodontists that are helping you plan the case ahead of time so that you can place the implant in the most favorable position. So I had the opportunity to do that, and it was wonderful. It's really elevated my practice and my surgical skill. And like for the most part, when it comes down to it, you have to be able to know what you need as a student when you're in your third and fourth year. Really assess yourself and be honest with yourself. I think Aspen is a wonderful AGD or GPR. A lot more practice will come from it than actually being in a program where you will only see 1 or 2 patients in the morning or 1 or 2 patients in the afternoon, just like Dr. Favor said. It's very similar to dental school, with just a few more things that you learn and get under your belt. Whereas with Aspen, you really hit the ground running and you're able to learn as much as you want, have mentorship if you wish to, and do the treatment that you're interested in. And you get CE courses that are provided by Aspen for pretty much anything you want to learn virtually. And you get to go to live courses like the implant course. You could also go into sinus lift courses if you want to do more in advanced surgeries. And there's courses that allow you to do more aesthetic restorative if that's what you're looking into. And then at least once a year, you get to learn more about dentures because we have an in-house lab. So obviously dentures are really big for Aspen and for all of us. So it gives you the opportunity to kind of hone your skills.
Awesome. Thank you, Dr. Flores. I think you answered a couple questions that we got in here.
I've been reading them.
Regarding some of the, that's awesome. Some of the, the education that Aspen provides. I think you hit the nail right on the head here. So I kind of wanted to shift gears a little bit regarding the market that you guys work in, and just let's kind of like touch upon location a little bit. So Dr. Flores, let's start with you because we were actually kind of talking regarding El Paso, Texas, and then the other parts of Texas that quote unquote may be a little bit more desirable, right? Or where, you know, kind of like the parts of Texas, whenever someone mentions the state, there's a few parts that, you know, that kind of like come top of mind. So what would you say are the advantages of working in a smaller market? And I want to kind of touch upon your patient demographic as well, right? So what are some of the advantages of working in El Paso, Texas? And then what does your patient demographic look like over there?
So one of the biggest advantages of working in an area that's underserved is the fact that there's not a lot of competition, not only with other DSOs or other Aspens, but with other dentists in general. There's plenty of patients for us to see without feeling stressed or like you have to go and try to figure out how to take someone's patients or worry about someone taking your patients. That doesn't really happen here. There's so many patients that we're able to see and help every single day. I think it's one of the biggest blessings. Another thing that's really helpful in being in an area where I'm kind of in an island is the fact that I am the only office in El Paso, Texas that has a lab in-house. So patients come to me. My lab technician, he's amazing. He's had 27 years of experience and he makes the most beautiful smiles. As a matter of fact, I know we're all transitioning to digital denture making and I'm excited for it, but I also know that he does such a beautiful job at adding that personal touch that I'm kind of I'm a little sad to see his personal touch go, but definitely it's one of the biggest things that brings patients into my practice. People see his work, our work, and they come in and they say like, hey, I saw so-and-so and I love their smile. I want my smile to look like that. How can we do it? And I'm like, well, you're in the right place. We're going to take good care of you. So we do a little bit of everything. I do implants, I do restorative, crown and bridge, a lot of dentures, a lot of extractions. And the main thing is, I think if you are in an area where you're not competing against other dentists, you're allowed the opportunity to help so many more people and your business can really thrive.
Awesome. Thank you, Dr. Flores. So I wanted to shift gears here a little bit. We have a couple questions regarding associate versus MCD. So Dr. Babore, I wanted to touch upon this with you. So we got a question that came in. How would you describe how your duties changed when you became an MCD? And do you have any tips for a smooth transition to this position?
Good question. I think that the biggest thing is it's more of like a personality thing. We, as a managing director and MCD, you're essentially in charge of running the entire clinic side. And so when, you know, there's things off with the wax try-in, patient wants these changes made, assistants have questions about things, you're always going to be the first one that they're going to go to if there's not an assistant that's been there for like a veteran assistant that can answer those. And so so it's really kind of making sure that you feel comfortable kind of with those questions or procedures or things that people are going to ask you, I think is a lot of that. I think just like, yeah, like I said, a great attitude is going to be a big thing. The big duties that I think changed for me as an associate into an MCD is, as an associate, I'm like, okay, I really want to make sure I'm good at just procedures. I was like, can I do like a couple fillings in an hour? I just didn't know what my timing looked like. And, you know, like anybody, any new grad, I was slow at first. I didn't know how I should plan for a crown prep. I had never done a molar root canal until I was out in the field. And so for me, it was kind of learning on the job. You know, I messed up. I made a mistake on a root canal and I perfed or I split a file. What do I do next? Like, what is my kind of steps there? And so for me as an associate, I think it's more just like a lot of the procedure side, learning the clinic And as you're feeling more comfortable with that, starting to learn what drives your business and understanding like, okay, you know, our patients are accepting treatment, but like we're having whatever issues here. How is a managing director, how can I smooth that out? What kind of systems can we put in place to make the office kind of run more efficiently and smoother? And so it's that second level of thinking that changes, I think, from an associate into the MCD position of really you're taking kind of ownership of the practice. Like you're the one people are going to go to. And so what are the things that you can do to make it run better, to smooth over things, to make sure everybody's kind of happy with that, I think is the biggest thing. The hard part about practicing is not the dentistry. It is managing your staff. And it is fillings, crown preps, root canals, extractions, implants, all that stuff is going to come. It's not going to be as scary as it is initially, because I was there too. A lot of it is going to eventually be like, all right, how do you have this hard conversation with this assistant? Or like, how do you, have a conversation maybe with a patient about something? How do you do that? And so that is a lot of, I think, how it changes kind of onto that other side. I knew I wanted to own. And so for me, I was like, okay, great. I'm going to learn, get the dentistry down pat as fast as I can. Obviously I still am learning things as I'm in the 2 years into this, but then I wanted to really transfer on to the business side. I was really curious about what it takes to run an office. I don't know. And so kind of learning that was really cool and very neat for me to see. So I think those are the biggest things that I realized in my transition over.
Awesome. Thank you, Dr. Babore. I wanted to stay with you here. We have a question regarding the difference between, I think we can kind of touch upon two things. So we can touch upon doctor compensation, and then we can also touch upon the difference between an associate and MCD compensation. Guaranteed daily rate, profit sharing, can absolutely expand on that a little bit. So without going into any numbers or any specifics, how would you best describe on what the doctor compensation looks like for an associate, and then when you transition to an MCD, what did that transition look like from a compensation perspective?
Cool. Okay. Good question. Because this is also one of the reasons that I chose Aspen in the first place. When you're at, I realized I didn't know this initially until I started interviewing, but when you're at a private practice, you are only paid based off of the cases that you physically touch. And so, you do a couple of fillings, things like that. You're only paid off of the production that you're actually putting your hands on. Aspen has a great model and a good setup where you are getting paid out for the entire office. And so I personally, as a new grad, I loved that. I didn't want to have to feel rushed in procedures. I didn't know how long, like I said, it was going to take me to do, a crown prep, to do a couple of fillings, to do a root canal that I had not done before. Like, I want to make sure that I can focus on that procedure and that's all I'm doing. And I don't have to feel like, oh my God, I have to do this fast because I have to go in to get into something else. Or I feel like I need to fight with the other dentist that was in my practice for the harder cases or for bigger paying cases because I wanted to be paid more. And so that took a lot of stress, I feel like, off of my shoulders, and just allowed me to kind of focus on whatever it was I needed to do. So that was a huge factor for me. Basically how the compensation works is you will have a daily rate that'll be your guaranteed. So no matter what, I will get paid my rate daily. If I come into the office and I'm there for 4 hours and then there's a storm and the electricity goes down and none of the patients show up, great, we shut down, I still get paid that daily rate. And then after that, if your office is profitable, then you'll get a percentage breakdown based on how how your patients essentially are rating you, like what is their survey scorecard. And so as an associate, you get anywhere between 8 to 10% off of the office. And as an MCD, that essentially doubles to 16 to 20%. And so that is a big kind of jump and a big increase kind of in pay. So, I mean, it essentially pretty much doubles or mostly doubles, at least the profit sharing compensation side.
Awesome. Thank you, Dr. Babore. I think you broke it down perfectly. That's a question that everyone wants to know, right? So Dr. Flores, want to transition to you here. We got a question that came in regarding your typical day. So you're the doctor in your office, and then you're also the owner as well, right? So, not only are you helping patients from a clinical perspective, but you're also the business owner of that office. So I know that you also mentioned that El Paso has a big patient demand, right? So what does your typical day look like on a day-to-day basis? How many patients a day? And then you also mentioned the the variety of procedures that you do. So I think this is where kind of like the root of the question comes from on what exactly does your day look like and how many patients do you see? If you can kind of like break that down and make it a little digestible for the audience.
So typically, what a regular day will look like, I'll go into the office, I'll have my morning huddle with my team. I always like to make sure that we speak for at least 10 to 15 minutes to get ready for the day so that we know what to expect and we know what's on the schedule. If there's anything that we can expect, we'll create kind of, we want to be able to be ahead of anything that could potentially create chaos in our office. So we go ahead and discuss what's on the schedule. If there's anyone who may not be so kind on the schedule, Dr. Favore mentioned earlier, it's not dentistry that's the toughest, it's dealing with other people, whether it be your staff or your patients. Definitely dealing with other personalities is the biggest hurdle that we have to see every single day and jump through every single day. But when we break it down, it makes it easier for us to have a successful day, and we're setting us up well for the rest of the day. I'll see about 9 new patients lately. It started off like 6 to 7, and lately it's been 9 recently. It's been a really good, healthy schedule with new patients. And I approximately will see about 15 patients in the morning, 15 in the afternoon. It's spaced out in different columns. So I have 5 columns that I run myself, where I see production. That's where I'm going to be seeing my fillings, my extractions, my extract and deliveries, my implants, endo, if I'm doing endo, crown and bridge. Then I have 2 hygiene columns. I have 2 hygienists in my office. I'll do exams there for recall. I have a column where I see my new patients and my priority patients. And I have a column where I do overflow, which is what we call appointments that are not necessarily fillings or restorative or extractions, like not a procedure per se that is productive, but it's a procedure that has to do with denture making steps or delivering of crowns or bridges. So it's definitely something that gets scheduled out. We try to schedule it so that it's scheduled smarter and not harder, because a lot of times people think it's not your own schedule and you don't get to run it, and that's a complete misunderstanding. I think everyone needs to take accountability. You're the doctor that's practicing. You get to decide what you're comfortable with seeing, how you're going to do your treatment, what you're going to do for a patient. And when you work with other dentists, you know that dentistry is super subjective. There's not one right answer. There's so many different right ways to get to the end goal. And everyone has different mentalities and different perspectives on how to treat the same thing. So it's if you happen to be in an office where you're doing treatment plans with other doctors, you can bounce each other's ideas off of each other and try to figure out what works best for you, but you're never required to do a treatment plan that you do not agree with. I saw one of those questions there, so I decided to touch on that because I think that's super duper important to know. On a day-to-day basis, you're doing the treatment that you treatment planned and that you agree with. And I always encourage other dentists coming into Aspen, make sure that you are comfortable with the treatment that you're doing and providing, and don't feel like you have to do anything, because patients will try to bully you into doing treatment that you don't want to do or that you know is not right. If it's not a filling, it's not a filling. If it needs a root canal and a crown, it needs a root canal and a crown. It's something that happens on a day-to-day basis, but typically we'll be quite busy with a healthy flow. And the biggest thing is learning how to manage your schedule so that you can be going from office to office, operatory to operatory without skipping a beat. It's very helpful when your team is on the same page and knows exactly how you flow and move so that they can set you up for success during the day.
Awesome. Thank you, Dr. Flores. So Dr. Babore, I wanted to shift gears here a little bit. Coming up on, I think, 5-ish minutes until the end of the session. You provided us with some great news. You just got accepted to one of our mission trips. So I think this is a common question from a lot of students is, how can we give back to whether it's our community, whether it's third world countries, whether it's just the unrepresented population. So if you want to provide your experience on how you went about getting accepted to the mission trip with Aspen, give us a little detail behind the backstory and why did you decide to do it?
Yeah, absolutely. So I was really excited. I got a phone call around lunchtime today that I got selected for this outreach trip. So I'm super pumped about that. We're going to go to Ecuador in September for a full week. We get to treat patients kind of from all over. And so I'm not sure entirely of the kind of dentistry I'm going to be doing down there, but I'm excited to be able to kind of go experience a new culture, help people that really, need it and are maybe unable to afford it or whatever it is, and just kind of be able to give back in a meaningful way. I think that for me as a minority woman and growing up with both immigrant parents, it has always been important for me to give voice and service to communities that are not always well represented. So that was part of the reason why when I graduated from my undergrad, I was applying to Teach for America, applying to the Peace Corps. I wanted to do something kind of meaningful with my time. Same thing as, now applying to this trip. So Aspen does a trip every single year where they do an outreach program. And so last year was in Mexico. My hygienist had done it. And he told me that he had the most amazing experience. He's like, you would not believe, these people are so grateful, so just like thankful for everything that you're doing for them. And I was able to do similar to Dr. Flores as well. I've done 2 implant courses, but one of them that Aspen partners with is in Guadalajara. And so I was able to kind of experience some of what dentistry is like, kind of just doing the service firsthand. And I knew I was like, okay, I want to do this again. That was one of the coolest experiences. I got to learn a lot about implants and how to place them, but also got to meet patients that I would never have been able to meet, and just to kind of see different cases and be able to kind of help and do a lot of great work. And so when this opportunity came up, I applied to it. It involves like a couple questions. They obviously ask for like your owner doctor and your regional manager's numbers and get their input. You can also submit like a small like video submission and basically just saying why you wanted to do it. And so I was really lucky to get selected. I think there's only like a handful of people that get to go on it. I think it's less than like 10. So I'm grateful. I'm really excited about it. So yeah, it was a great opportunity for me.
Awesome. Congratulations. Thank you, Dr. Babore. Looks like we're coming up on time here. So wanted to just conclude it with this. Dr. Flores, we can start with you. I know we have a lot of dental students on tonight's session. Want to thank you all for joining us. What would you say is the biggest piece of advice you have for a current dental student, whatever year they are, whether they're D1 all the way up to D4? What would you say is just to kind of like make it relatable to your story and your thought process when you were a dental student? Like, what would be your biggest piece of advice for a current student right now?
My biggest piece of advice, I think I mentioned it earlier, I'll touch on it again. Push yourself. Get yourself uncomfortable, try cases that you might shy away from right now that you're in dental school, because you are surrounded by a ton of dentists who can help you improve your skills as a student. And if you're not quite sure what you want to do and you're interested in finding out if Aspen is for you, there's Aspens all over the nation. You're able to reach out to many of us. Miles and Deanne can put you in contact with anyone that's in the area that you're going to school so that you can go check out an Aspen, just like Dr. Favor did. See if you like it. And one of the greatest things that I don't think we've mentioned is if you are interested in Aspen, you don't have to worry about it being a contract that you may not be able to break if you're not happy with Aspen. It works both ways. So Aspen wants us to be happy as providers, but they also want to make sure that the providers that they are bringing on are providers that are taking care of patients and doing right by people. So if the partnership is there and you're happy and Aspen is happy, everything flows. If for whatever reason you say like Aspen is not for me, you can always part ways and there's not a problem. There's not a non-compete. You're able to practice around that area. And that's one of the biggest things that I think most people are unaware of. It's the only DSO that allows you to come on board and try it out if you're interested in doing it and see if it's for you. I think the biggest thing is sometimes we're afraid to be pushed out of our comfort zone, but that's when the greatest growth actually happens, when we're uncomfortable and we're in situations that are different from what we would feel capable of. So I think it's one of the best companies to work with for mentorship, for growth opportunities, and for helping underserved communities.
Awesome. Thank you, Dr. Flores. Dr. Babore, I think it's your time to take us home here. What would be your biggest piece of advice to a current dental student?
Well, Dr. Flores took mine. I was going to say to be a sponge and learn everything that you possibly can. But I will say, I think one of the biggest things that's kind of helped me, that someone said to me my first day, is to roll with the punches. You have no idea what you're walking into with the rooms. You have no idea kind of what procedures you're going to have to do or what things are going to look like. And you never kind of know, and you have to be able to kind of switch and be like, okay, cool. As dentists, we are very type A about things. We want things to go a certain way. We always envision it as like, this is how it's going to be. And 99% of the time, it never goes like that. And so being able to be like, okay, cool. Like that was like not the plan, didn't work out like how I wanted it to be. So let's figure out another way to do this. Like, all right, let me get insight from other people. Utilize the people that are around you. I cannot tell you the amount of times my assistants, my hygienists, my lab technician, they've saved me from and helped me with so many things. And so these people are your people. You're going to be spending so much time with them. And so treat them as part of family, learn from them. They're going to help save your back. You're going to help them as well. And so being able to kind of pivot and be able to roll with it and just being able to adapt to change is going to be one of the biggest assets that you're going to have kind of going in.
Awesome. Thank you, Dr. Babore. I just want to thank the doctors for joining us tonight, Dr. Flores and Dr. Babore. You guys are rock stars. I will always tell you that, how amazing you guys are. I want to thank all the attendees for joining us as well. I will be following up with everyone, sending them the recording to tonight's session. If you have any follow-up questions, please feel free to reach out. I'm going to also be sending Dr. Babore and Dr. Flores. I'm going to be sending over your email to the students as well, just if they have any follow-up questions for you guys, and they want to learn a little bit more. We got some awesome questions in tonight, and I think we answered all of them, whether we answered them at once or we answered them as kind of a more elongated answer. So want to thank everyone again for joining. And then we also will be reaching out to the raffle winners as well, that attended and that registered. So I just want to thank everyone and have a great night. And we'll be in touch, and I'll be reaching out. Thank you, doctors. Really appreciate it.
Thanks, guys.
Thank you.
Thank you, everyone.
Have a good night.